Welcome back, friends. Heart disease, it remains the leading killer in America. But even if you do have a family history, heart disease and heart attacks are not inevitable. But how do you protect yourself? Dr. Omar Al-Masali from Frontenac Cardiovascular Center is here this morning with some advice. Good morning to you, sir.
Good morning. Thank you. Thanks for the introduction.
So as we mentioned right off the top, heart disease, a leading killer in the United States. Please tell us a little bit.
It is true, and it's still a leading killer in men and women both. At the same time, it's the most preventable disease, and what we're trying to see is if we can prevent that way ahead before somebody has symptoms. Now, most symptoms of heart disease the people know is when somebody's having a heart attack. They say having chest pain, dizziness, lightheadedness. They go to the emergency room having heart attack, and then when we try to interfere and then try to take care of it and prevent it. Some folks have what we call angina, which is more like a pain on the chest when they have exertional symptoms. They walk, they have chest pain, they stop, that will go away. We call that angina or stable angina.
Okay.
What we're trying to say is we're trying to see people before they get to that far, maybe like 10 years before. Anytime we see patients having those symptoms, we still take care of them, but we want to say, what if we seen this person 20 years ago or 10 years ago, and we've done something to prevent that, to prevent it from getting to that stage. And that's what we talk about, the test that we have.
Early detection is huge. What are the tests that you do, and who might be the perfect candidate for these tests?
That's a good question. If I may show some of the model here, most of us, this is more like a magnified section of the heart vessel here. The very first one here is like when we were born, where the arteries of the heart nice and clean. And as we get older, with all kind of food and all the diets that we have, we start building up cholesterol plaque buildup into the arteries of the heart. As we go to that stage, that's when we start having symptoms, when the arteries started building up and almost closing up, and that's when somebody has a heart attack. So at some stage, if we can detect this disease at this stage here, 10 years before they're having symptoms, we can make a difference where we can prevent that. The new test that we have called cardiac scan, which is a CAT scan of the heart, which is very precise test to show how much plaque one has in the arteries of the heart, even at earlier stages. So some of those pictures here showing, this is a normal scan showing the normal artery, and then this is somebody who has some buildup at this, pretty much similar to this stage here, where they have like 40% buildup. Those people would not have symptoms yet, but knowing that one has 40%, 50% buildup, they want to do something about it, more prevention with diet, more medications if needed, to prevent it from getting to the point that where they have the symptoms and do that. Bottom line, prevention makes a big difference.
So for our friends at home who they personally have not had heart issues, but maybe their mom or their dad or a sibling has, what should they do?
The best thing to do, we call them risk factors. People who have more than one or two risk factors like diabetes, high cholesterol, family history of heart disease, smoking history. If they have more than one risk factor, they better have it checked so they know. A lot of times, you know, if you check and you know you have the tendency to have heart disease and you do something about it, you totally prevent it and prevent yourself from getting to the point that to have a heart attack and having those symptoms. The test is simple. We have entry level called the calcium scoring, which is very simple test. No IV needed, no preparation. The patient can walk in, get the test done within 10-15 minutes. We get the results. It tells you what's the tendency to have heart disease or not. And then based on that, if they need further testing and further treatment, we can take care of that.
Early detection is key. Dr. Al-Masali, thank you so much.
Thank you, pleasure. Thank you very much. Thank
Frontenac Cardiovascular Center is located on Clayton Road in Frontenac. You can call them at the number on your screen, which is 314-733-9090, or visit them on the web at frontenaccardiovascular.com. Matt, that early detection is so key.
An ounce of prevention is worth a pound of cure. That's what they say, right? Thank you guys very much.